Welcome to our podcast, Oncology Morning Commute, addressing bias in patient care. Morning Commute is developed in collaboration with At Point of Care and Projects in Knowledge and is part of a continuing medical education series. This independent CME CE activity is supported by an educational grant from Astellas, Merck & Company, Pharmacyclics, an AbbVie company, and Janssen Biotech. In this episode, Dr. Otis Brawley and Dr. Christopher Flowers take a look at how implicit bias can impact patient care. What is unconscious bias and how can clinicians become more aware of their own biases? Information about the faculty and disclosures can be found at morningcommutepodcast.com/disparities3. You can use this link to receive your credit and evaluate this program. The URL can also be accessed in the episode notes. Dr. Brawley is a professor in the Department of Oncology at Johns Hopkins University, Baltimore, Maryland. Dr. Flowers is division head ad interim of the Division of Cancer Medicine and is professor and chair of lymphoma and myeloma at MD Anderson Cancer Center, Houston, Texas. I am Candace Hoffman, managing editor of Morning Commute. Dr. Brawley will begin our discussion.
Hello, this is Otis Brawley discussing bias in patient care with Dr. Chris Flowers. Chris, thanks for joining me.
Great. Thanks, Otis. Appreciate being here.
First, what is unconscious or implicit bias? Can you give us a definition?
Yeah, so unconscious bias is exactly that. It is something that is completely unconscious to the individual who's expressing this bias. And these biases are implicit in the decisions that we make about either patient care and oftentimes other things. These are biases that are ingrained into our ways of thinking, and unless we explicitly make ourselves aware of that these biases exist, we will make decisions without knowing that these are affecting the ways that our decisions are being made.
You know, one of the implicit bias is almost assumptions that people make about other people. It's almost human to do that, don't you think?
So yes, I mean, there are some well-known biases that all of us commonly make as shortcuts. These are, heuristics that we use to be able to reduce complexity, particularly when making decisions. And so in the decision-making literature, these are very well known in terms of biases we make about rounding numbers, biases that we make around reducing uncertainty to help us to make decisions in a less complex way. And so I think these are natural components of being human to help with our decision-making process to reduce things that are much more complex and much more nuanced. And that's why they become unconscious.
Is it a human tendency to spend more time with patients that you like, or patients that you know, or patients that are like you versus patients that are not like you?
So I think, one of the things that's actually been helpful to make these sorts of unconscious or implicit biases better surface have been studies that actually study the way physicians behave and the ways that others behave in terms of the ways that these biases applied. And so, as you mentioned, it's known that from some data from a randomized controlled trial that physicians spend less time with minority patients than non-minority patients, which could lead to worse patient education, could lead to worse outcomes for those patients in terms of their disease state understanding or treatment, and that there also are biases that physicians display like the ones that you described, that they're more commonly spend time with patients that are more like them or that they enjoy spending time with, as opposed to patients that are cantankerous or difficult or argumentative.
In some of the health disparities work that I've done, it's interesting some of the biases that we have and where some of the biases have come from. Some of them are actually due to our socioeconomic system. We have biases that certain cancers are more aggressive in people of certain races. Well, some of the data to support that comes from the lack of insurance or the types of hospitals that people go to, whether or not they're adequately staged well. I mean, in colorectal cancer, we used to think that colorectal cancer was more aggressive in blacks versus whites. Then we found out the blacks that we based that on were not as well staged after surgery by the pathologist because the pathologist who takes care of people that hospitals where blacks go tend to be busier than the pathologists in hospitals where whites go. So that it's a bias that ended up supporting some additional biases. I've also been concerned, there's a study that was published about 5 years ago that surveyed medical students. And it seemed that medical students had the bias that Black people don't feel pain the way white people do. And this, of course, these sorts of biases can affect how well we treat pain and ultimately affect our relationships with our patients because we're ignoring people when we have these sorts of problems. What do you think about that?
Yeah, so what you're talking about are biological constructs that are developed around sociologic phenomena. And so, some of these biological constructs become ingrained in our ways of thinking about the ways that we take care of patients. And they can influence the treatment decisions that we make based on those biases. I think more broadly in terms of the kinds of implicit biases that all of us have. And I think that's one of the other things to be aware of about unconscious or implicit bias is that not only is it unconscious, but it's also ubiquitous. Everybody has these biases about the ways that they see other human beings or the ways that they make decisions. And so the first important part of that is to make sure that we are aware of our own biases. And there are techniques like implicit bias training to help people to become more aware of their own implicit biases. And then secondarily, to try and disentangle some of these biological constructs that you've described that may influence the ways that we treat cancer patients, and just to be aware that those can exist.
One of the things that you've taught me in some of our conversations is the importance of open-mindedness and the importance of actually caring about every patient.
Yes, being open-minded and being data-driven in terms of what the data actually show us in more modern studies really can be quite helpful in terms of understanding each individual that's put in front of you and to respond to the data that you have at hand, not to some preconceived notions of what the data are going to show.
What we're really talking about here is professionalism, isn't that the case?
These really are key components of professionalism, and being and providing outstanding care to patients really requires that level of professionalism, to be aware of what your biases are, to be aware and conscious of what each patient brings to the table, something we talked about in the last podcast. And to be able to react to the data directly at hand and to try and to provide the best care to each individual who's in front of you.
My experience, and tell me if this is yours, if the patient feels that I care for them and the patient feels that I am concerned about them, the patient is more likely to be adherent to therapy and end up having better outcomes.
Absolutely. That's been shown in studies time and time again that the trusting relationship between a doctor and patient helps with adherence to therapy, helps with outcomes. It increases enrollment on clinical trials. On the other side of things, actually reduces physician lawsuits in terms of patients suing patients if there is a trusting relationship. And so building that is critical to the care for so many different reasons.
I wish we could spend more time with our patients, learn about their socioeconomic situation, their social supports and social demographics, actually show that we care about the patient and also understand the hurdles the patient has to go through in order to get good care. It would help us so much with care. So, Chris, thank you so much for this conversation. This is Dr. Otis Brawley talking to Dr. Chris Flowers, addressing bias in patient care.
Thanks, Otis.
Thank you for joining us today. Remember, to receive your credit and evaluate this program, please visit morningcommutepodcast.com/disparities3. For all the episodes in this series, please visit morningcommutepodcast.com/disparities.